are genetic drivers behind eating disorders for sure. And they affect, upwards of 5 to 9% of the general population. Within the realm of athletics, it's much higher, and we'll get into that a little bit. But there are four, but really three primary categories. I like thinking about it like that versus labels.
Mm-hmm.
So you have your restrictive eaters, you have the folks that are overeating or binging, and you have the cyclical eating disorders or disordered eating patterns that can erupt. Very important to distinguish between disordered eating and a full-blown eating disorder, because disordered eating symptoms can kind of just hang out in the environment. They could be basically maladaptive ways of coping with stress. So that's a really good way of thinking about it. Within the restrictive category, you have anorexia nervosa and something called ARFID, or avoidant restrictive food intake disorder. Those are the two primary categories. Think about it this way. Someone's not getting in enough nutrition. It's very much a math equation. And as a result, it's causing all kinds of physical symptoms to develop, and we'll talk about that in a second. But the difference between the two is the cognition, the drive for thinness. The person with anorexia has that disordered voice chipping at them, telling them to not eat or to use XYZ behavior. The person with avoidant restrictive food intake disorder, or ARFID, which is a new diagnosis, there's no voice, or at least we don't think that there's a voice. They just struggle with getting nutrition in. 10% of the time, though, as you start to weight restore the person, we find that it was anorexia all along. Anyway, second category, the overeaters.
Okay.
Binge eating. It's when someone is eating much more than anybody would agree is normal at one specific time. And this needs to happen at least once a week for a certain period of time, usually 3 months. But it's also associated with a lot of shame and guilt from that, and can be the result of a hole in their life or anxiety or something that they're trying to get under control. So if we learn nothing else today, eating disorders are not about food. They're about control. So it is a means of gaining control. So you have the binge eaters are doing that. Overeating is a means of that. Then you have the cyclical pattern, which is those that are using a binge eating with a compensatory behavior. Notice the way I'm phrasing that. It's not just restriction. It could be other ways of eliminating calories. Again, math equation, in and out. It could be over-exercise. It could be using a diuretic or a laxative. It could be restricting how much they take in. So there's these three categories: restriction, binging, and the cyclical, that if you frame it that way, it's a lot easier to communicate.